Hello all, I am Dr. Walter from SNS College of Physiotherapy. So today we are going to see another new topic, a pediatric condition, that is spina bifida. Why I am saying it is a pediatric condition? Okay, this spina bifida is occurring only due to the congenital disorder. Okay, what is congenital disorder? So congenital disorder will be transferring from one phase to another, that is from the genes, while during the pregnancy time or to the fetus growth, and all these things will be contributing for the what congenital disorder. Now spina bifida, it is a divided into three types. I am telling about the introduction, and these three types will be of different stages. Now first of all, we are going for the definition. What is it? Spina bifida is a congenital condition characterized by the incomplete development of the spinal cord and the protective coverings. What is the incomplete spinal cord? To the end of the area, that is the end part of the spinal cord. So this end part will not be going for the complete closure, and the area surrounding that will not be going for the complete fusion. Okay, now so this is also called as neural tube defect, NTD. So for examination purposes, if they are asking, write a essay on NTD, that is neural tube defect, you will be writing for the spinal bifida. Okay, now going for the incidence. So approximately 1 in 2500 live births. For example, today 2500 children are being born onto this whole world, and among that one children will be going for the spina bifida and the other three types. Okay, now significance. So significance will be going for different clinical manifestations which can affect the mobility and the sensory function and the organ systems. Based on the characteristics, we are going to divide how these are divided. Now going for the next slide, that is understanding the neural tube defects, commonly known as the etiology and the pathogenesis. First one is genetic predisposition. Already I have told you about the, it is carried from gene to gene. Now a family history of the neural tube defect can increase the risk of the genetic component of the spina bifida. Next one is maternal diabetes. What is maternal diabetes? Now poorly controlled diabetes in mother prior to the conception and during early pregnancy is also a causes for the NTD. Understood? Now going for the folic acid deficiency. What is folic acid deficiency? And this folic acid is also coming for the vitamin B9. Okay, now maternal fever or hyperthermia. Maternal fever during to the pregnancy time, any type of viral fever which was affected for the mother, and this virus is also will be carried for the children, and also the hyper body temperatures, certain medications, and all these things. Nowadays we are taking n number of medications for each and every condition. For example, if you are going for a headache, we will be taking a headache tablet. If we are having a stomach pain, we are taking a stomach pain tablet. If you are having any type of shoulder pain or leg pain or any pain, we are going for painkillers. And one such condition will be developing any type of side effects, and you need to be very careful while we are taking, while we are suggesting for the any people. And one next thing is, and anticonvulsant drugs when during the taken during the pregnancy. Now going for the next slide, that is the classification. Already I told you about the three types of classification, and one is spina bifida occulta. What is it? Spina bifida is a small gap in the vertebra, that is the last part, small gap without protrusion. It is not coming out of the spinal cord, and the meninges also will not be coming out. So this area will be covered with a clumsy or a bunch of hair. Now second one is meningocele. and this meningocele will be going for the rare form of the meninges, and here it will be coming up a protrusion onto the back area, and this protrusion will be having the CSF fluid, the spin and the membrane. Myelomeningocele, the third and the last thing, and this is most severe and the most common type also. What will happen in these stages? The spinal cord, meninges, nerve roots, CSF, all these things will be protruding out in the back area. Okay, and these two things will be having the protrusion at the back area along with a tuft of hair. Now, going for the next one, that is the clinical manifestation. Okay, so this we can see a children with a knee brace standing with the help of the knee brace. Neurological, musculoskeletal and the urological. And neurological will be going for the paralysis, sensory loss below the lesion level, that is below the leg, and most probably I am saying that is apart from the L5, coming down from the L5, all these things will be going for the sensory loss, and all these things will be going for the hydrocephalus will be risk factor, and going for the musculoskeletal, it is muscle weakness. Okay, so in this picture you can able to see a muscle. This is a thing which is kept for the standing up for the children's, and this splint will be helpful for the children, small children, to be standing for and walking also. And urological, it is a neurogenic bladder, the control of the urination will be absent. Okay, and going for the next one, that is the diagnostic approach. Diagnostic approach is prenatal, postnatal, associated conditions. Prenatal is alpha fetoprotein, an important lab test you need to consider for the pregnancy people before pregnancy. That is the prenatal stage. Postnatal, after getting pregnant, and all these stages are going. Physical examination, MRI, CT scans will be helpful to detect the spina bifida. Associated conditions, that is hydrocephalus, Charry malformation and the tethered cord syndrome will be developing the spina bifida. And the last one is the physiotherapy assessment. As we are physiotherapists, we need to be very careful in assessment and also the treatment protocol. Motor function and strength, we need to analyze the motor function, how much the range of motion is present, how much the muscles tension is present, we need to analyze. Posture and alignment. In this condition, the small children will be going for the scoliosis, that is S-shaped spine. And sensory assessment, already we have learned this assessment in detail, but in simple, light touch, pain, temperature, all these things we need to sense it out. Functional mobility, gait analysis. For this gait analysis, we can able to make the children to walk and to make the children going for the standing up in one leg, bilateral, unilateral stance phase. Transferring skills from the bed to chair and chair to standing, all these things will be initiated. And the last one is the aerial activities and the independent mobility. So this is about the 100% we are making the small children with spina bifida of any stage, we are making the children to walk on their alone. And this is about the spina bifida. Hope you might have studied this in a full-fledged, and thank you. We'll meet on next video.